Gomez-Aldana. I'm transplant hepatologist, and I would like to show the challenges faced by the ENT doctor and his researcher about the study blinding. So the first challenge that I'm seeing here is how they're going to compare a Rhino a topical steroid medication, with a placebo, which in this case we need to define if it's a pill or it's an inhaler. And also they would like to compare it with that antihistaminic, which in this case would be oral. And this is probably the first challenge in this randomized phase 2 trial, to define which would be the best alternative to compare, because one recommendation from my side would be to use a dummy, so a placebo inhaler, because some patients would feel that this inhaled steroid is going to work much better than the oral pill. And this dummy would also contain medication, no medication, a preparation that causes the same symptoms or the same flavors once the patients are using it, so in that way they could mitigate the bias. They are also going to check the efficacy using this score, the TNSS, which is the total nasal sign and symptoms, which could induce a clinical bias, because the problem in this case is that the patients could be lenient to describe an improvement with X or Y medication. So, and this is one of the concerns, how you are going to use a clinical score. But in this case, they can do it, but they would rely on the blinding. If they're going to do a single blind with the patient, or a double blinding between the clinical, with a clinical and patient blinding trial. But also they could do an option which is the single versus third blinded. In this case, the patient is going to use the medication, but the investigator is not going to be aware of what is the therapy that the patient is receiving. However, in this case, I would like to once again recommend to use a dummy, just to reduce the impact on this therapy. Thank you.